The internet is flooded with DIY tutorials. Do it yourself for everything under the sun, and dentistry seems to be no exception. Now, while the idea of fixing a chipped tooth or whitening your smile from home might sound appealing, the reality of DIY dentistry is fraught with danger. I think you should leave dentistry to the professionals, and I'm going to explain why. I'm Dr. Rachel. I'm a holistic dentist with over 30 years in practice, and I'm going to go through the risks of do-it-yourself dental work and why it's a bad thing for you and your teeth. Imagine that your tooth is like a complex machine or, like an aeroplane or something like that, with many delicate parts. Now, brushing and flossing are like regular maintenance, keeping the machine running smoothly. The dentist is the skilled engineer and mechanic who can diagnose problems, fix broken parts, your cavities, your fillings, and even replace major components, doing crowns and implants if needed. DIY dentistry is like trying to fix that machine yourself with tools you don't quite understand, and you don't really understand all the workings and ins and outs of this machine and which part does what. And, if you touch something, what knock-on effect that might have. So you might patch a small leak, for example, do a temporary fix, but you could also loosen vital components, damaging the machine further or creating a bigger problem that requires a professional to fix it. In the end, attempting DIY dentistry might seem cheaper initially, but it could lead to more pain and expense down the road. So let's take a deeper dive into this. Let's have a look at why you should steer clear of doing any DIY dental practices on yourself. These are the pitfalls of DIY dental procedures. Well, number one, lack of expertise. Dental procedures require an understanding of anatomy, physiology, medicine, pathology, and the use of specialised tools. Without the knowledge, even seemingly simple tasks like, removing a loose tooth, for example, or whitening teeth can lead to complications like nerve damage, excessive tooth sensitivity, or gum recession. Also, there's a lot of delicate structures in here, and if you're going to go rampaging around there, you could cut something and end up in a right mess. It just makes me shudder to think about it. So, you could damage your teeth further, you can cause bigger problems. Then there's improper sterilisation. Now, in dental offices, we follow strict sterilisation protocols to have our equipment at medical grade sterilisation. This is to prevent the spread of bacteria and viruses and infection. At home, you've got no chance of achieving the same level of sterility. It's nearly impossible, and that's going to increase the risk of you incurring a serious mouth infection. There's misdiagnosis. Many dental problems share similar symptoms, and a chipped tooth might indicate a cavity that needs professional treatment. And while attempting to whiten your teeth at home could irritate sensitive gums already affected by gum disease, or if you put whitening stuff on and you've got a cavity, you're going to be putting whitening chemicals directly inside your tooth and onto the nerve, and you could create a painful infection and dental abscess and then end up needing a root canal when all you needed was a simple little filling. Without proper diagnosis, DIY treatments can really make existing problems a lot worse. Then you're buying over-the-counter whitening or filling kits, and those products might not be appropriate for your specific needs. And using the wrong materials can lead to allergic reactions, tooth decay, or uneven whitening results, and the complications of this can be quite costly. Now, recently, I had a patient of mine, quite a smart lady. She's a teacher, and she'd been going to a colleague of mine for Invisalign. I'd sent her to a proper orthodontist because her case was outside of my scope. And she'd been in treatment and things had gone really well, and treatment had finished, and she was in retainers. And retainers are meant to keep your teeth in position so they don't drift back. Now, she decided on her own, without having any discussion with me or her orthodontist, that one of the teeth wasn't quite where she thought it should be looking from her angle in the mirror. So she started cutting up bits of plastic and shoving them inside the retainer in an attempt to get this tooth to move where she thought it should go. Now, she'd got no freaking clue what she was doing. She got no idea the implications of putting pressure on this tooth and how to move the tooth. And she came to see me for a checkup, and I couldn't understand why this tooth was loose. It was still in relatively good alignment, but it was loose, like really loose. And what she'd been doing by putting these bits of plastic inside her retainers was jiggling this tooth backwards and forwards. Now, if you jiggle a tooth backwards and forwards, you're going to loosen up the bone that holds this teeth in. And by the time she saw me, she had what we measured as a 7mm pocket. That means this is a tooth, this is the root. She's lost 7mm of bone around a root that is only 9mm long. Because she was doing jiggling around do-it-yourself orthodontics without talking to anyone. Now, it's highly likely she's going to lose that tooth, and there's nothing we can do. We have splintered it in place and we're hoping to see some bone grow back, but the damage may have already been done. And I share that story with you because if she loses that tooth now, it's in her smile line. She's going to have an extraction, a bone graft, and a dental implant. She's going to have a denture while she waits for the implant to integrate before she can have the crown put on. She's facing at least $12,000 worth of treatment because she thought she should jiggle this tooth around on her own. Probably would have cost her about another $500 to have a refinement set of aligners done if she had spoken to her orthodontics. I know, I'm just flabbergasted. But anyway, complications, I share this story because complications of DIY dentistry can be costly, both financially and physically. The initial savings from DIY dentistry can really quickly disappear if complications arrive. If you get infections, you get nerve damage, you get further tooth decay, you might have to have emergency dental procedures, and they are usually more expensive than the initial problem you were trying to fix. So what are the alternatives? And look, I get what drives people to do it. They don't want to be going backwards and forwards to the dentist. They're scared, they're anxious, they don't have time. Or they just don't have the money. And I get that as well. And this is where open communication with us is very important. We do understand the financial concerns that you face. Talk openly with us about your budget. We can work out some different ways of going about the treatment maybe. We can offer payment plans. We can help resource things that, sometimes we can help you get in at clinics where they can do things for you without charging. We can explore using the dental school, for example. They'll often do reduced cost services because you're having it done by a supervised dental student. And this can be a great option for quality care at a lower price. There are community clinics, there's non-for-profit organisations or public health departments that offer low or free dental cost, low-cost dental care to underserved communities. Now, your oral health matters. Your oral health is intricately and exquisitely linked to your overall well-being. Neglecting your dental problems can lead to serious health consequences like heart disease, diabetes complications, respiratory issues, infections, and even things like cancers and dementia. Regular dental checks and professional treatment, that's the key. They might require some planning. They might require a little bit of investment for you for your long-term health, but we'll help you with that. We can help you with payment plans and other options. And the bottom line is this, guys. DIY projects are fun. I love doing DIY. It's fun and it's rewarding. But I stick to areas of my life where I know I can do these things without effing up and making it cost a fortune. Now, your smile is not the place to experiment on. Don't go watching a video on YouTube or Instagram or TikTok and think, I could do that. I could fix that myself. Not when it comes to your teeth and mouth. For safe and effective dental care, Seek the expertise of a qualified dentist, please. We can properly diagnose your concerns, we can recommend the best course of treatment, and we can help you to achieve a healthy and beautiful smile. And we can do that to fit within your budget a lot of the time. Now, if you want to know how to have a healthy, beautiful smile and what you can do to safely care for your mouth and teeth at home, then check out this video here.